I've been associated with Mary Free Bed for 57 years.
This is where he feels like he can. This is where he's accepted for who he is, for how he is.
Everybody at Mary Free Bed has touched a part of me. They are the most caring and lovable people.
They have things like the Mary Free Bed Inn. We moved all the way from Benton Harbor. These guys have a hotel to stay in. It's like it's everything you can ask for rehab. It's like they answer your questions before you ask them.
Josh is just learning, with us not holding the walker so much for stability, how to do it. So it's a kind of a new area we've progressed to.
We're about function. We're about doing. Living and doing is our mantra. Each individual we allow to be more functional, and that then equates to higher quality of life. One of the things that we do at Mary Free Bed that you're not going to see at other institutions are that we meet together formally as a team, and we sit down and with every team member in every discipline, sit down and say, what are the goals that we have for this patient, both short and long term? And we constantly redefine those goals as a patient goes through the process of being at Mary Free Bed.
Very nice.
It's always been about the people. It's always been about taking care of the patient. And literally, how would you want your family member to be treated? Everybody here believes and treats every patient as though it were family.
The connection between a therapist or a physician or a specialist or a nurse and the patient when they're together is the most connected thing I've ever seen. The focus is totally on the patient. It's a loving look, true compassionate, loving look, and it's as if that care provider has no other care in the world but that patient. What I've been telling new employees, groups, each month as they get oriented, is you are empowered to take the risk to go way beyond what you think you can do for a patient.
It's especially applicable to my situation because I've stayed in the room with John the whole time. I've never left.
Next up is ice cream.
It's just not a typical environment. There's nothing intrusive about it. You're just allowed to be a family, which is really important. I mean, my son is 9 and he's a little boy. He is not longitudinal myelitis, which is what he had been up until now. And so now he's just allowed to be a little boy. He's not a diagnosis anymore.
There's something new that you're seeing all the time, and each individual patient is treated as an individual, and whatever's going on with them is treated individually. You can't package it and just say, I'm going to treat everybody the same way, because the treatment process is different for everyone that you work with.
This is a mission for me, it's a mission for all of our people, and Mary Free Bed is just one of the best missions you could possibly hope for to be part of, because restoring hope and freedom through rehabilitation is our mission. And what that basically means to me is that we're changing the future of people's lives. So somebody who has a disability, we're helping them get better so that their futures are what they want them to be.
We have one of the most extensive recreational therapy programs and what I'll call adaptive sports programs in the country. And that's a real commitment of Mary Free Bed and our guild to our patients. These aren't areas that are often served in most communities. What an incredible gift it is for our community to have this adaptive sports programs.
Work hard, skate hard, like Kaz said, okay? This is the time when you're gonna get better.
This staff is so knowledgeable of equipment that's available, of therapies, of treatments. They are able to make things here for you. And we've watched that progression, because since '93, we have watched the progression of what's available, and they're always trying to stay right on top of things.
One example I think for me that is just phenomenal is our motion analysis lab.
Our whole purpose here is to give treating clinicians more information than they can get just watching somebody walk in the clinic.
This is the state of the art for determining how we best treat walking impairments in children and adults.
Mary Free Bed is one of 9 accredited facilities in the world. That accreditation basically tells the community that our service has been vetted by other professionals in the field for quality and consistency of data. We have force plates embedded in the walkway that allow us to understand the forces that are coming up from the floor through the limb. We're also recording about 120 frames per second in the motion capture.
As the patient comes through the space, you can see that the red arrows are visualizing how the foot interacts with the floor. Combined with our motion data, as you see here as our patient comes through the volume, is calculate how those forces are distributed through the joints, from the ankle to the knee to the hip.
Our study is very cost effective as compared to ordering braces, prolonged therapy, surgical procedures that may not be to the patient's best advantage.
We look at the patient on a one-on-one basis and figure out what are their specific needs to accomplishing whatever task it is, technology related though. That could be from addressing computers, since I no longer have the physical function to be able to do this. Maybe it's environmental control, turning on lights and answering telephones and turning on their stereo system, TVs, those kind of things. There's not a ton of people around that are educated in this area to be able to meld both the commercial industry products that are available with the assistive technology specific products. That melding together is what makes us special.
The patient will come in for an evaluation, and that is where they decide what type of frame they want, what type of other supports that they need. I talk with therapists, we interact a lot, and it's all very hands-on, and we measure kind of what we want as far as trunk supports here, where we want them to be, where we're going to cut them out, to get feedback from parents of pediatric kids that they are just sitting better, they're comfortable, they are in their chair a lot longer than they've ever been. Not too many jobs where you get satisfaction at the end of the day knowing that you helped somebody make their life better. Working here has taught me to be thankful for the little things. I don't take things for granted. I don't know how you could working in this environment, because things can change just like that, and I know that. And so just thankful for every day.
The way that I explain it to people is chronic pain and chronic fatigue. That's the easiest way for me to explain what I live with.
The thing about fibromyalgia is it's a syndrome. You can't take a test for it. It's a collection of symptoms, which is very much what ends up being frustrating.
I have a physical therapist, Mike. My occupational therapist, Linda, and Amy is my counselor.
You want to let the body weight do the work. She's got to keep her shoulder down and keep her elbow in. Otherwise, you see them doing this sometimes as they get more tired. So you got to remind them, but she did really good. And you're up 28%, and I raised it a pound.
We're able to get people back to work much greater than typical treatments, medications, etc., because none of them address the rehabilitation component. There's a belief that, well, if I just get rid of my pain, then I could go back to my life. And that's just simply not true, because A, you never get rid of it. Even the best medications out there knock it out about 25% of your pain, and people go crazy trying to get more medications because it takes that edge off in that 25%. Well, in the studies that we've done, our patients without medications, taking them off of those narcotics, gets on average a 25% decrease. But what we also then add to it is, well, what are you going to do with the rest of the 75%? How are you going to interact with it? And that's why rehabilitation for chronic pain is critical. All the research that I've seen, whether you've had a successful surgery or you're on narcotics, it doesn't really ever speak to the fact, does this actually get people back to their life? When they have no hope, and in 8 weeks, there's not only hope, but there's real change. There's no better job in the world to do this. I mean, again, on average, 10 years of misery and suffering, and in 2 months, which sounds like a long time, and it's through a ton of hard work on their part, but the strength that our patients have inside of them to be able to learn how to get control again and live the life that they always wanted to live, it's a great job.
In the last year and a half, we have formed a lot of relationships with various community hospitals around us. We've actually connected in partnership with a few of them. So now, instead of being a hospital, we're now a network. And instead of a hospital, we're a main campus and satellite campuses.
We have therapists who do nothing but spinal cord care. That is different from any other place in the state of Michigan. We have therapists who specialize in brain injury, in stroke, in pediatric care, and in cancer, as well as medically complex problems. So when individuals require comprehensive care from experts who do nothing but take care of certain diagnoses, you go to the person who does that on a regular basis.
We're changing the future of people's lives. we're helping them get better so that their futures are what they want them to be.
Absolutely, 100% true. They got my hope and I have my freedom. I do, and that's what they gave me. Because I would not have had that had I not come to Mary Free Bed.